How old are you?
14.
Okay. This is a 14-year-old patient that presented to us with Tourette's.
Hey!
Okay. So what are the tics that you experience?
I have a lot of neck twitches, as you can see. I usually just have to crack my neck. I have to keep flipping the hair out of my face because it touches my eyes and that just bugs me. Hey! I yell a lot. I have a few verbal tics. I have to say things. I haven't been doing those lately though. I've been really doing the necks twitches a lot lately. So.
Do you want to say
Keep doing it. Keep explaining to the audience.
I have some kicking and hitting tics. I don't actually hit people, but I have to hit walls and stuff, mostly to give off pressure. I bump into stuff a lot. Sometimes I have to bang my knuckle off of something until it hurts. If it doesn't hurt, then I have to keep doing it. Lately I've been doing I have to flex my bones and my muscles and stuff. Sometimes I have to like squint and make faces. Usually when I look in the mirror, I have to. Just because I have to see myself do it. I have to do it in a certain way. Otherwise I have to keep doing it. It has to be perfect or I have to keep doing it. It also really has to do with OCD, my Tourette's. That's pretty much why I have to get it perfect. So. Hey! Usually when I'm nervous and stuff, or if I have more attention, I do more tics. So. It doesn't matter if it's good attention or bad attention, so. I do have a lot of fun with Tourette's sometimes. With friends, we just joke about it and stuff. It's fun being in an environment where kids can accept you for who you are. I was lucky to be in an environment like that.
But all the world's not that easy, right? You get cussed out a lot and looked at.
Yeah. I love acting and stuff, but I went to this theater in Spring Grove, and this girl actually came out and cussed me out because she was upset that I was ticking during the play. But I just explained to her I had Tourette's, and I went on with it. I try not to let that sort of thing bother me, so that I can just live on with my life happily. It's not good to focus on that sort of thing. I did have depression from Tourette's around 2007 because I used to let it hit me hard, so just stopped focusing on that. So.
Okay.
We're going to do the best we can for this young boy. Fortunately, he's understands his problem because he has a IQ of 128. These patients are not low IQ children. They're very, very smart, trapped in this disease, and this is what the dental profession should be doing to help these children out all the time.
This is his occlusion right now, open wide. This is the appliance in his mouth, and it's highly indexed. Bite. Now see, and he goes right into the indexing, and this moves the mandible forward, taking the pressure off his temporomandibular joints and reducing the recurrent dislocations. So just look into the camera and let them see your face. Do you want to mention any benefits or non-benefits you've received over the past 6 days?
Well, actually, I got a lot of benefits. Right away, I actually I stopped doing tics a lot, and lately I haven't done them at all. But I did take my brace off one time, and I actually had a tic explosion where I was going nuts. I think that happened because I took the brace off. So that was the downfall part. But I think this brace really works.
This is Jesse as he returns 6 weeks later. And what we've done is convert his intraoral orthotic from a pivot appliance to a repositioning appliance, where we have lowered the height of his appliance and indexed it, so he is now biting with his mandible in a forward position here. This further decompresses the tissues of his temporomandibular joint. Okay, pan him. You can see him here. Look in the camera here, and say something to the viewing audience here. How you've been doing in the last 6 weeks? You've been in a school play.
I've been in a school play and a band concert.
Okay, don't look at me. Look at him.
Oh, sorry.
Okay.
And I've actually gotten to the point where it's working so well, I kind of forget it's in my mouth and it's just there. It's already it's part of a normal day routine with it now. And a lot of my tics, I've noticed, have kind of drifted away to the point where they mostly never come up. I haven't gotten mad at all since I've gotten this piece in, to the point where I've yelled at someone. I haven't yelled at anybody in a long time now. I haven't been emotionally overbearing at all in any state. And I have a clear mind every time I have it in, that I can think about my work and get it done. And my grade's been going up. So.
I'd like to introduce you to Jesse's father here, who has accompanied him, and to say a few words. Come on in here.
Yeah, Jesse's teachers have reported back to us that his tics are significantly less during class time. His focus is better, and we've definitely felt around the house that Jesse's ticking less and that he's more peaceful. There's some kind of emotional connection here too, where just not ticking so much has helped him to relax in a lot of areas. But he was yelling certain words 2 to 3 times a minute, and now we can go an hour and not hear it at all. So.
This is a view of the patient's habitual bite in centric occlusion. Notice the mandibular dental midline is off to the patient's left. When you see this occurring, check the maxillary and mandibular frenum, which are the skeletal midlines of the maxilla and mandible, to see that they are aligned one over top the other. Also notice the deepness of his bite. His upper incisors overlap about 70 to 75% the length of the lower incisors. To you, this may be good incisal guidance, but to me, it is very, very harmful. This is a view of this patient's occlusion on the right side. It is a class 1 dental relationship. This is a view of the patient's left side in habitual occlusion. Notice the premature loss of a lower left second bicuspid. The clinical information pertinent to this patient is as follows. MRI imaging shows that the right TMJ disc is medially displaced. This was on the coronal images. He was diagnosed with Tourette's at 7 years of age. Prior to 7, he was diagnosed with attention deficit hyperactive disorder and obsessive compulsive disorder. These are medical diagnoses by his pediatrician and family physician. He has left temporal headaches 2 to 3 times per month, which are so severe that it forces him to go to bed for relief. Examination showed bilateral TMJ clicking upon opening the mouth. He bruxed his teeth. He has a constant barking sound which decreases when I repositioned his mandible edge to edge at a height of 2 tongue blades. He also suffers from bilateral tinnitus, which is a humming sound. He has left and right face pain, worse on the right than the left. It's painful for him to chew food. He has left and right neck pains, left and right stiff necks, cervical crepitus upon movement of his head left and right, and left and right shoulder pain. When I palpated around his head and his neck, he elicited a painful reaction in 38 different anatomical areas. Okay, this is Justin, who has come into our office, and as you can see that he's a Tourette's patient, and we're going to begin his treatment today with fitting him with a lower mouthpiece to stop all these uncontrollable motions that he has. And we're going to videotape these motions for a minute or two, just so the viewing audience can appreciate what he has to go through. Justin is a 17-year-old young man who began suffering from these things at the age of 8 years of age, and it's about time that he got rid of them, and this is what we're going to do for him today. Okay, I've just finished working on the appliance, and we're going to put it in for the very first time right now on this young gentleman. Did that hurt you?
No, it's checking.
Yeah, bite. How's that feel now?
Weird.
Does it feel even? Or does one side feel a little higher than the other?
Feels pretty even.
I am inserting the lower mouthpiece at what I think is the correct vertical height. This is the most critical element in the delivery process. As you will see, this is not the correct vertical for this patient because we subsequently modified it by adding to this height the thickness of 1, then 2, and then 3 wooden tongue blades. And with each addition, the patient reported that his symptoms and urges improved. We then added additional acrylic to take into account this additional height of these 3 tongue blades to the original height of the appliance. And you will see the response of the patient to this height. Chop, chop.
Just really.
Tell me what's happening to you.
Well, what?
Does the urges seem less?
I guess. It's not really, I don't really shut my mouth. It's
Yeah, I don't want you to shut your mouth.
like close my jaw.
Open.
Now, are we just seeing if my chicks come?
That's what?
If my chicks are coming down. Is that what we're doing here?
Yeah, just see if it's calming them down more.
It is.
With this in there?
Yeah. It's just a little bit.
Does that help you? The tongue blade help you? Seem to be helping you?
You put a lot better. Right there. 2 of them. Or 2 more.
Okay. Try 3. Tell me if 3 is better than 2.
Oh! Two and 3. I mean, they're both
Okay.
the same.
Take it out. Mix me up some stuff. I've added some additional acrylic here,
Thank you.
the amount being the thickness of those 3 additional tongue blades. Now I'm going to let the acrylic harden and trim it to the thickness of those 3 tongue blades. Can you tell that's higher?
Yeah.
How's that feel?
A lot better. It's a big difference.
It quiets you right down, doesn't it?
Yeah. Just a little bit. My tics are just way much more calmed down.
Yeah. Let's give him a new appliance. He had broken the clasps off his original appliance, which decreased his stability. His symptoms did not return. He has been wearing an appliance for a total of 5 months. And we are showing you this video footage to show that his corrections and improvements are long-lasting. He will tell you that his symptoms started to diminish within a week of the original appliance's insertion, and they have been gone for the last 5 months and stayed gone. In his history, he also had 5 years of constant everyday occipital headaches, which are headaches in the back of his head, every single day for 5 years prior to coming to see me, and he hasn't had any of those at all since the insertion of this appliance. He's going to say something to the viewing audience, and now just tell them what you how you're coming along.
I am doing fantastic since I've got this appliance in. It has, my tics have completely diminished. Even after I have my appliance out, my tics are still not there for hours and hours after I have my appliance in. I haven't really tried to go days, but I've had them out for a couple hours.
He's had a total of, he estimates, of 20 ticks.
Yes.
He got this appliance over the summer, and the children in his previous grade school knew about his tics, so he went and registered in a brand new high school, and they are totally unaware that he is a Tourette's patient. He's got them all fooled.
Yep.
And he started to make relationships with girls now, got them fooled too.
Trying to.
Good for you. Anyway, he's going to continue wearing this, and It's very, in my opinion, it's very easy to treat these Tourette's patients, at least teenage boys and girls. They're much more easy to treat or respond a lot quicker than Tourette's patients in their 40s and 50s. Those are the ones that seems to be more resistant to treatment and takes longer to treatment and takes greater skills to treat. It's much easier to treat these youngsters.
Justin is doing so much better. He hardly notices, his tics, and he started at a new school, and they haven't even noticed that he has Tourette's. And when we first went in to talk to him, we told him how bad it was, and they can't believe it, because he doesn't tic at all, hardly. I mean, it's an amazing difference.
Have you brought home a young girlfriend yet?
Not yet, but we're working on it.
Oh, okay. Well, that'll probably be the next step. Okay. This patient returns after 2 months since his last appointment. We haven't adjusted his appliance yet. He tells us it's worn down a little bit and his tics are starting to creep back in a little bit, and so we're going to adjust his appliance, check it completely out, restore it completely, and then send him on his way. Another telltale sign is how deep his bite is. Most of these patients with the appliance in will have an open bite when their symptoms are gone. And this patient has worn down the appliance, so his teeth are overlapping them a lot. An overlap like this might be good in a normal patient, but is not good in a Tourette's patient. We want an increased vertical dimension. We have just finished adjusting and rebuilding this patient's appliance. We have increased its height. Remember when he bit down, his teeth overlapped about 30 or 40%. Now when he bites down, he is open about 3 or 4 millimeters. This represents about a 6 or 7 millimeter increase in height on his appliance. Do not be afraid of going into an open bite scenario when you build these patients' appliances. They need all the occlusal support you can give them to support these joints here, or decompress these joints and take the pressure off the auricular temporal nerves and its branches. We built his appliance up vertically, increasing its vertical height today. Zoom in. Right. So he goes from about the level of where my thumb is to this amount of opening right here. This is a considerable increase. He feels it benefits him. It decreases his urges and his tics.
Yeah, significantly.
You want to tell the audience how you've been in the last 6 months?
Good, yeah. I mean, it has worn down probably the past 3 months or so. It's a lot. And you can tell my tics they come back. But they aren't as, bad as they used to be, even with it worn down, but it feels good.
Okay. Okay, and you feel we're helping you out?
Yeah.
Okay, good. Okay, it's been 3 months since you've been in here. How have you been doing?
Great.
Good.
Yeah,
No
great.
problems?
No?
Okay, we're going to build your appliance up today. Okay. And in fact, it's already built up and it's hardening up, and I'm going to polish it up and fit it to you. And we'll have it ready for you in about 5 minutes. Okay?
Okay.
This patient returns after 2 months since his last appointment. We haven't adjusted his appliance yet. He tells us it's worn down a little bit and his tics are starting to creep back in a little bit, and so we're going to adjust his appliance, check it completely out, restore it completely, and then send him on his way. And that's what this appointment will consist of. Bite. Come in from the front. Another telltale sign is how deep his bite is. Most of these patients with the appliance in will have an open bite when their symptoms are gone. And this patient has worn down the appliance, so his teeth are overlapping them a lot. An overlap like this might be good in a normal patient, but is not good in a Tourette's patient. We want an increased vertical dimension. We have just finished adjusting and rebuilding this patient's appliance. We have increased its height. Remember when he bit down, his teeth overlapped about 30 or 40%. Now when he bites down, he is open about 3 or 4 millimeters. This represents about a 6 or 7 millimeter increase in height on his appliance. Do not be afraid of going into an open bite scenario when you build these patients' appliances. They need all the occlusal support you can give them to support these joints here, or decompress these joints and take the pressure off the auricular temporal nerves and its branches. Turns for a treatment checkup. It's been several months since we've last seen him, and his appliance had worn down, and his tics had started to creep on back, and we have rebuilt the appliance at this appointment. And he's going to tell the viewing audience how he's been coming along in the past several months.
Okay. It's been progressing fairly well. It's still, when it wears down, my tics come back slowly, but it's far better than what it was before I even had the appliance. My tics are 80 to 90% gone. I still have some, but it's not as near as it was.
And you're off all medications, right?
Yeah, for this.
Okay, good. This patient is 21 years old. He has a maximum interincisal opening between his incisors of 80 to 81 millimeters, and left lateral excursions of 18 millimeters and right lateral excursion of 8 millimeters. The MRI report says the temporomandibular discs are within the condyles bilaterally. I don't know what this means, other than the radiologist who read the report is unfamiliar with TM joint radiology. There is no translocation between the closed and the open mouth positions. This really means there is no translation of the condyle between the closed and open mouth positions, which is highly unusual for a person who can open 80 to 81 millimeters. His tics consist of eye blinking and eye rolling, head jerks, facial grimaces, nose twitching, mouth opening, lip licking, grunting, snorting, and spitting. Whistling, arm extending, touching objects, smelling objects, jumping, skipping, and hopping, tensing muscle groups, making animal-like sounds, unusual voice changes, and self-injurious behavior. Previous treatment he's received is 2 years of orthodontic treatment, multiple neurologists, psychiatric care for the past 11 years. His medications are Tegretol, clonidine, haloperidol, Klonopin, Lovesa, benzotropine, Vistaril, Zoloft, and medical marijuana. Additional treatment consists of a deep brain stimulator implanted 2 years ago, and then a second deep brain stimulator implanted 1 year ago, neither of which has worked. His self-injurious behaviors consist of biting his cheeks, gagging himself, slams the side of his body with his elbows. He tried to gouge out his left eye due to tics and severe pain in the left eye, and was put on a 17-day medically induced coma. This is this patient's frontal head x-ray. Notice the brain stimulator implanted on his left side and the one implanted on his right side. Notice the wires that run from these down his neck into his chest on either side. While looking at this x-ray, observe the overgrowth of his nasal turbinates, which have deviated his septum to his left side, and the misshapen piriform or nasal fossa. This is his patient's lateral skull x-ray. You can see the implanted deep brain stimulators and the wires that go up over the brain and down the head and down the side of the neck into his chest. This is this patient's submental vertex X-ray. You can see all the wiring implanted in his skull. Notice also that one side of his skull is a little bit convex, where the other side is flattened or concave. This is a severe cranial distortion and should be addressed. This is a young male that comes in with Tourette's syndrome. He's got eye-blinking tics, head-jerk tics, facial grimaces, nose twitching, lip licking, snorting, grunting, spitting, whistling, jumping around, hopping, tensing of muscle groups, grunting, and a half a dozen other tics. He also has a self-injurious tic. You can notice his left eye patch, where he had a tic in the center of his left eyeball that he tried to calm down. This resulted in him being put in a hospital-induced coma for 17 days to heal the area. He's had 2 deep brain surgical stimulators placed in his brain, which have done no good for the tic in the center of his left eyeball. He also has left face pain and left cheek or cheekbone pain. His MRI is negative for TMJ dysfunction. And he comes in wearing a lower splint like this. We'll put this in. Yeah. But it doesn't give him any relief. He wears a dowel here on top of it to increase his vertical. And it is this vertical that gives him some relief and decreases his urges. So today we made him an appliance, which we're going to deliver right now, which our starting point, our starting height is going to be the combined height of these 2 appliances. Like this. So when he occludes down, this is going to be his opening here. He says this diminishes his urges approximately 50%. And that's after just a couple of minutes of the appliance sitting in there. Okay, how's that feel? Good. You want to say anything to the viewing audience? Like all that you've been through and things like that? No. This is your chance now. You're on television.
Okay, I don't want to be on television.
Oh, he's shy. He's shy. Okay. I'm just teasing.
You're not on television. So.
I know I'm not on television.
Okay. We're going to dismiss him now overnight, and he's going to return tomorrow for his first checkup. And we'll show you what his appearance is and the decrease in his tics when we view him tomorrow. Returns after wearing the appliance approximately 24 hours. He felt it was a little bit too low, so I increased the height 2 millimeters on each side, which is the thickness of 1 tongue blade. You can tell from his countenance that he's already improved in a short period of time. Notice how the patient's head is more upright, that his facial grimaces and distortions have decreased, and most importantly of all, his shoulders have squared off, so his posture has changed. Do you have anything to say to the viewing audience?
No.
You happy with what I'm doing for you?
Yes.
Okay. Thank your father for making it available to you. You owe him big time. Big time. This Tourette's patient is 21 years old, and his tics began at 10 years of age. This is a late date for saying the tics began. Usually they begin prior to 10 years of age. Constant blinking was his first tic, He now has vocal tics and repeats things constantly. His body is always hot. Asthma my whole life. Was scheduled for deep brain surgery 2 days prior to my first exam at Johns Hopkins University. His parents canceled the deep brain surgery and decided to come see me instead. TMJ symptoms consist of bilateral TMJ clicking upon mandibular protrusion, right TMJ crepitus upon opening of the mouth, bilateral frontal headaches for years and years, bilateral temporal headaches for years and years, left face pain, constant clearing of the throat, a maximum interincisal opening of 50 to 53 millimeters, left lateral excursions of 7 millimeters, right lateral excursions of 8 millimeters. Since these lateral excursions are limited, you might suspect medial disc displacement. The MRI report says there's no evidence of anterior disc displacement in either joint, which you would surmise from the fact that he had an interincisal opening of 50 to 53 millimeters. However, the coronal images show bilateral medial disc displacement, which is the reason for the diminished lateral excursions of the mandible. This is a young man who's 21 years old, who's a Tourette's patient, who found out about us 2 days before he was scheduled for deep brain implantation at the Mayo Clinic. And his parents canceled that surgery and came to see us. And we are working him up, and we took an impression for a lower appliance, which we are going to deliver tomorrow, and then check up on the next day. Here. When did the symptoms, the tics and all start?
5th grade.
5th grade. How many years ago was that?
10 years ago.
10 years ago. And you have both eyelid tics and you have vocal tics?
Vocal tics and movement. It really gets worse in the afternoon and at evening. Right now, it's pretty mild.
Okay. And you had a tic explosion yesterday.
Yeah, yesterday when it was around 2 o'clock, and all day it was just kept repeating what I was saying, speaking loudly, having that my head moved jerking, and moving my jaw around, and that's about it.
This young man has traveled all the way from Charlotte, North Carolina to see us, and we're going to do our very best possible work to eliminate these tics.
Yeah, if we're doing something exciting or something that I wouldn't do every day, like came here, it was exciting learning about this, and yesterday we went to the Washington monuments and all that. My tics get unbearable, and I'll sweat, I'll get headaches, and we had to call the day early yesterday because it was so bad.
Oh, you had to go home early from your touring?
Well, yeah, we had the choice to stay, but I chose to go.
Okay.
Yeah.
Great. Well, it's interfering with your personal life. And
oh,
so
yeah.
We have to stop that.
Okay, so then what are the improvements that you've noticed since the beginning of treatment?
Well, before I had headaches every day. My jaw would be sore from a tic, but when I put this in, my jaw tic settled down. It's pretty much gone now. I haven't had a headache yet. I've maybe had 1 or 2 within the month, but that could have been anything. But I feel better. I notice when I take it off, my tics do come back, but I see a major improvement every day. I used to not be able to talk to people without having a massive load of tics, but now I am. I'm able to go to shops, Walmart, anything, and just browse. I used to not be able to do that before, but now I am able to.
This is Zachary. Zachary's a 22-year-old boy who first experienced Tourette's at 7 years of age. He came to my office a day or two ago, and we took an MRI on him. We took x-rays on him today, and we've prepared a splint for him, and we're going to deliver it today. Tell the audience what you've been going through the past 8 years or so with your Tourette's. Tell them all the tics you have. You have head tics, face
Head
tics.
facial, some verbal, like grunting, whole body jerks, shoulder. I mean, I probably tear a lot of muscles, pull muscles with my shoulder tics that I have. Always sore. I mean, I never complain about it, but I'm always sore 24/7. Hopefully they go away.
You sweat a lot.
Yeah, I mean, I drink maybe 3-4 gallons of water a day, and it comes right back out like it's nothing. So,
Okay, how do you do in school?
not very good.
Grade-wise?
B to D. I mean, college, it was a lot better. It was A to C, so I don't know.
How do you do with the girls?
All right. I mean, I got